Hi, I'm Dr. Schaeffer. I'm an endoscopic nasal and sinus surgeon for the past 20 years. I'm going to go over some information regarding sinus infections and sinus surgery that I offer to my patients. 37 million Americans suffer with sinusitis. It's a common problem. When patients have it for longer than 3 months, it's called chronic sinusitis. The symptoms usually involve nasal congestion, headache, drip, cough, mucus in the throat and phlegm, fatigue, and sometimes fever. The sinuses, to go over the anatomy, there are 4 on each side of your face. They're the cheek sinus, called the maxillary sinuses, the ethmoid or eye sinuses, the forehead or frontal sinuses, and a back sphenoid sinus. They all produce mucus, which then drains in through the back of the nose to help cleanse the nose and airway. When they get blocked, the mucus sits there and stagnates and becomes infected. The little openings get blocked due to a cold, allergy, nasal polyps, or sometimes a deviated nasal septum. So treatment usually involves putting patients on antibiotics, nasal sprays, decongestants, antihistamines, seeing an allergist, and being evaluated by a nasal surgeon like myself. When we evaluate you, we look into the nose with a special telescope or endoscope to look at the passageways. Sometimes we can see that the septum is crooked or deviated, or that there are polyps, and we can drain the infection, which normally you can't do just by blowing your nose. Sometimes we take cultures, but ultimately if your symptoms last longer than 3 months, we usually like to obtain a CAT scan to see where the blockages are and which sinuses are blocked. As a result of that, if you still have persistent symptoms despite being on several courses of antibiotics, nasal sprays, using sinus irrigation such as Neilmed, sinus rinse, or a neti pot, and using saltwater rinses, then you may be a candidate for sinus surgery. Sinus surgery is done as an outpatient where you're put to sleep under general anesthesia. While you're asleep, I look into the nose with a little telescope, remove any crooked cartilage and bone to straighten the septum, and open the passageways. This typically takes about an hour, recovery room is another hour, and you go home. We do recommend you take a week out of work, 2 weeks out of heavy lifting or exercising. We recommend that you don't fly for 2 weeks and that you take it easy for the first few days. Since I don't pack the nose, patients feel pretty comfortable and feel like they're ready to go back in a week, but we recommend you take that time off. You can do desk work in 2 to 3 days. And also we recommend that you avoid any aspirin, Advil, Motrin, Nuprin, Aleve, because that thins out the blood and can make you bleed. After surgery, we recommend you keep your head elevated on 2 pillows at night. Use a cool mist humidifier. No nose blowing for 2 weeks. As a result of surgery, you should be breathing better. Remember, the results of surgery may not cure you, but they can also make you decrease the frequency, duration, and intensity of the infections. Every patient's an individual, and we need to individualize the treatment for each patient. I'll stop there.